What if the insurance plan you were sold as a better deal was actually designed to pay out as little as possible, and the people working inside the system were trained to avoid you because of it? That's not a conspiracy theory. That's something a healthcare worker with nearly a decade of experience laid out in detail on Reddit, and today we're going to walk through every single part of it. Let's start with the thing that stopped this person cold on their very first day working in healthcare. They were told point blank by their supervisor, get as many traditional Medicare patients as possible. Not Medicare Advantage, traditional Medicare. And when they asked why, the answer was simple. Medicare always pays, and it always pays the most. That was the moment that planted a seed. And after 9 years working across home health agencies, skilled nursing facilities, doctors' offices, and inpatient rehab as a registered nurse, that seed grew into a very clear picture of what's actually going on inside these systems. So let's talk about stakes, because this affects millions of people. Right now, nearly half of all Medicare-eligible Americans are enrolled in a Medicare Advantage plan. These are the plans you see advertised constantly, on television, in your mailbox, through phone calls that never seem to stop. The ads promise extra benefits, lower costs, dental, vision, gym memberships. They make it sound like you'd be leaving money on the table if you didn't sign up. And the people signing up are often seniors, people in their 60s, 70s, and 80s, who are making decisions that will directly affect the kind of medical care they can access for the rest of their lives. The problem is that what these plans look like in the advertisement and what they look like when you actually need serious medical care are two very different things. And most people don't find that out until they're already sick, already in the hospital, already trying to get into a rehab facility. And that's the worst possible time to discover your coverage has walls you didn't know existed. This healthcare worker's story begins with their very first job in the medical field, working admissions at a skilled nursing facility, specifically filling short-term rehabilitation beds. Their job was to look at a list of patients being discharged from local hospitals who needed inpatient therapy, reach out to those hospitals, confirm a bed was available, handle the paperwork, get any necessary authorizations, and greet the patient when they arrived. Simple enough on the surface. But the difference in how that process worked, depending on whether someone had traditional Medicare versus a Medicare Advantage plan, was night and day. For traditional Medicare patients, there was essentially no barrier. No phone calls to insurance companies, no authorization numbers to chase down. The patient needed care, there was a bed, they came in. That was it. And what did traditional Medicare cover once they were there? An hour of therapy per day, full coverage for the first 20 days, then continued coverage for up to 100 days total, with a secondary insurance picking up what Medicare didn't cover, meaning many patients got 100 days at essentially zero out-of-pocket cost. That is a significant safety net for someone recovering from a stroke, a hip replacement, or a serious fall. Now let's look at what happened with Medicare Advantage patients going through that same process. First, there was no just walking in. Before anything could happen, the admissions worker had to call a number, present the diagnosis using specific medical codes, and wait for an authorization number to be issued. Without that authorization, the facility couldn't accept the patient. So right away, you have a layer of bureaucracy standing between a sick person and the care their doctor says they need. But it gets worse. Once authorized, these patients were typically looking at 20 days of coverage at 100%, but with only 30 minutes of therapy per day instead of an hour. Half the rehab. And then, after those 20 days, in many cases coverage stopped entirely. Done. The patient became 100% financially responsible for every day beyond that. For someone who needs 60 or 70 days of inpatient rehab to safely return home, that is a catastrophic gap. And remember, this is not a terrible plan someone stumbled into. This is Medicare Advantage. This is the product that was marketed to them as an upgrade. The second job this person held was as a home health scheduler. Their role was to coordinate nurses and therapists visiting patients in their homes. Every morning they'd come in, get a stack of referral papers, and arrange schedules. Some referrals were traditional Medicare. Some were Medicare Advantage plans through large national insurers that most people would recognize by name. And again, the instruction from management was the same. Staff the Medicare patients first. Priority goes to traditional Medicare. When they asked why, again, the answer was the same. Medicare always pays, and it always pays the most. Think about what that means in practice. If you are a Medicare Advantage patient waiting for a home health nurse or a physical therapist to come to your house after a hospitalization, you are lower priority than the traditional Medicare patient. Not because anyone hates you, not because the scheduling coordinator is malicious, but because the business has learned through experience that traditional Medicare reimburses reliably and generously, and Medicare Advantage plans create friction, pay less, and sometimes don't pay at all. Now let's zoom out for a moment and connect these two experiences to something bigger. What's actually happening with Medicare Advantage is that the federal government pays a fixed amount per enrollee to private insurance companies to manage that person's Medicare benefits. The insurance company's incentive is to keep costs down because the less they spend on your care, the more they keep. This creates a system where prior authorizations, those phone calls, those codes, those waiting periods, become a tool to delay or deny care. And studies have confirmed this. Medicare Advantage plans deny significantly more claims than traditional Medicare. Prior authorization requests are sometimes denied not because the care isn't medically necessary, but because denial is built into the financial model. The people working inside these systems see this every single day. They see which patients get waved through and which patients hit walls. They see which insurance cards make their jobs easier and which ones mean hours of phone calls just to get someone a bed they clearly need. After working in home health, this person moved on to a doctor's office and then eventually became a registered nurse working inpatient rehab. 9 years, 4 different settings, and the pattern they observed never changed. Traditional Medicare moved smoothly through the system. Medicare Advantage created friction at every turn, friction that translated directly into less care, more out-of-pocket costs, and more stress for the patients who could least afford it. So what should you actually take away from all of this? Because it's not enough to just be angry about a broken system. You need to know what to do. First, if you or someone you love is approaching Medicare eligibility, do not make your enrollment decision based on television commercials. The people making those ads are not your healthcare advocate. They are selling you a product. Before you commit to any plan, find an independent Medicare counselor, someone who is not paid a commission by any insurance company. Every state has a program called SHIP, the State Health Insurance Assistance Program, and it provides free, unbiased Medicare counseling. Use it. Second, understand the difference between what Medicare Advantage promises and what it delivers when care gets serious. The extra dental or vision benefit might sound nice, but if you ever need inpatient rehabilitation, home health services, or extended skilled nursing care, traditional Medicare is almost always going to provide more coverage with less resistance. Run the numbers for your actual health situation, not the best-case scenario the ad is designed to make you imagine. Third, if you are already in a Medicare Advantage plan and you feel like you've been denied care that your doctor recommended, you have appeal rights. Document everything. Get every denial in writing. Ask your doctor to submit documentation supporting medical necessity. The appeals process is real and it does work, but only if you use it and only if you know it exists. Fourth, and this is especially important if you are helping an elderly parent or family member navigate their health care, learn the terms. Know what prior authorization means. Know what a skilled nursing facility is versus a regular nursing home. Know the difference between Medicare Part A, Part B, and what Advantage plans actually replace. Knowledge is the only protection you have in a system that is not designed to explain itself to you. The person who shared this story spent nearly a decade watching the same patterns repeat across every setting they worked in. They weren't looking to cause trouble, they were just doing their jobs. But what they saw was consistent, it was systemic, and it directly affected real patients at some of the most vulnerable moments of their lives. They shared it because they wanted people to know before they needed to know, not after. if something like this has happened to you, if you or someone you love signed up for a Medicare Advantage plan thinking you were getting something better, and then found out the hard way what the fine print actually meant, you are not alone, and you are not the one who made the mistake. You were given incomplete information, and the first step to protecting yourself going forward is knowing the truth about how these plans actually work. If this video helped you understand something you didn't before, or if you think someone you know needs to hear this, share it with them. And if you want more videos breaking down how the healthcare and insurance industry really works from the inside out, not the version they put in the commercials, but the version the people working in it actually see, subscribe. Because this is exactly the kind of thing we cover here, and there is a lot more where this came from.